as therapists, we always say never go to Dr. Google, don't we? Always. But apparently, 1 in 7 of us now are using AI chatbots for healthcare. Staggering, right? I mean, what do you think about that?
1 in 7?
Yeah, 1 in 7.
Oh, wow. That's quite dangerous, though, isn't it?
Dangerous? Why? What's skepticism all about?
Well, what can AI do about it? They can't prescribe antibiotics, like if you need antibiotics, or actually get you an X-ray or anything like that. Obviously, you can help you maybe find out what the problem is, but it's not going to treat that problem.
But what about a car? Like learning how to do a compress on a car, or getting a fever down, or I mean, yeah, you're not a believer. You're a total skeptic.
Yeah, no, because again, if you do that and it's like, get the fever down, what if you miss something, the reason why that fever's there? Like, especially if it's looking up for a child. Yeah, I know children get fevers, but what if in that instance they didn't? They missed it, they didn't go to the doctor, oh no, it's a fever, I'll get the fever down. And then the child's suffering from severe tonsillitis that leads to sepsis. Like, yeah, my concern is that it's dangerous. But I can see the benefits. I myself have put in blood results into ChatGPT, and what it does, and I think it's really good in the sense that it talks about all the things, like areas that I'm down in, what it could be, but what I need to raise with my GP and what next steps should look like. And then it'll be like, oh, would you like me to prepare a PDF to take to the doctors? And I think that's really useful.
Definitely, yeah. I mean, I think AI is such a big conversation at the moment, isn't it? And I'm constantly saying to people, I think we're living in a revolution right now, aren't we? An AI revolution, and healthcare is obviously going to be a massive part of that, whether it's physical and mental health as well. But I don't want to get into a point where it's bad, because yeah, of course there are some good points to it as well. And I think, like you say, getting a PDF ready or a big report, it can read a report for you in a split second, can't it? So, and take it to your doctor. I think, of course, stuff like that is very, very helpful. But yeah, of course, there are drawbacks as well.
Yeah, and that's just something I think that I would want people to be mindful of. It can be supportive, but it does not replace a GP.
No. I mean, of course, GP's always got to be the first port of call, hasn't it? But then, apparently, reading this research from King's College London, 25% of the people surveyed, I think there were 2,083, 25% of them cited the reason that it was so long to get a GP appointment. So that's why they actually went to the AI chatbot in the first place. So I guess that kind of says it all, doesn't it?
Yeah, I can see that. Yeah, it is definitely more difficult to get a GP appointment, and then I don't know about you, but mine in this area is complete inaccurates. And then I think what doesn't help is then when you actually do speak to the GP, they'll be like, and how can I help you? And it's like, well, I've just spent half an hour filling out that massive long form. Have you not read it? So I think as well that GPs have got things to think about in terms of patient care when it comes to communication and helping people feel heard, cared about, all those kind of things, to help encourage people to not lose faith in doctors, rebuilding that kind of trust.
Yeah, I guess one of the issues is that I hear a lot from clients that they can only bring one issue at a time to their appointments. And I mean, if you'd have said that to someone 15, 20 years ago, they think, bloody hell, what are you talking about, love? Come on, that's what you go for your GP for, isn't it? But it's true. It is a common thing now. You can only bring one problem at a time.
Yeah, and I guess the whole situation leaves people feeling rushed. So how do you manage that? Should GP have longer appointment times to spend more time checking in with people? I don't know what the answer is, but I know something needs to be done to rebuild trust and to bring back that, what they'd say, bedside manner. Because I don't know if you've had any experiences, but I have, and sometimes you end up speaking to a doctor and you really don't feel heard, you really don't feel listened to. And then how do you trust them to manage your healthcare moving forward when you don't feel like they've heard anything you've said?
Yeah, I hear that a lot about not being heard, listened to, kind of pushed out the door, kind of conveyor belt doctoring, so to call it these days. And yeah, I suppose it's another sad indicator of where we are at the moment, isn't it? Healthcare wise. I mean, of course,
Yeah.
there are, I think, the vast majority of doctors are brilliant doctors, and all our nurses
Yeah.
and the NHS. Yeah, so I've said before, very proud of it. But ultimately, it's an issue, isn't it? When we have to wait so long for an appointment these days and can only bring one issue at a time. And I guess that's a huge reason why people are falling onto chatbots, because they are so impressive, aren't they? They talk to you in such a split second, and the advice they give seems so authentic as well. So you can understand people why they're doing it.
And it comes across empathic as well. And I don't know, when I've used like ChatGPT, if I pop in like blood results, it'll bring up previous conversations and previous blood results and relate it to previous things I've asked it. And it'll be like, oh, this could link to your iron deficiency, and it'll bring it back. So like already it's quite impressive. It remembers things, whereas quite often I think people feel like GPs and doctors don't remember things. They're not looking over medical records before they attend the appointment. So mistakes are made that leaves people feeling like they're not paying attention.
Definitely. I mean, yeah, we've only mentioned ChatGPT so far, but there are plenty these days, aren't there? And I actually tested a couple of years ago, actually, doing a crisis chat with ChatGPT to see what it would be like. And it was quite disappointing, actually. Like I was saying, some pretty worrying, concerning stuff to see what it would do, because that was something I was concerned about, because I know people with depression have been using it for a long time, AI, and it wasn't really coming back with much support like crisis numbers or a crisis kind of plan. It was just more going through the motions, kind of repetitive. But that was 2 years ago, and as I said at the start of the video, we are in a revolution, and I'm sure it's moved on very quickly. I mean, I was using Gemini the other day, and it even wasn't like a dark chat. It was about research I was doing, and it brought up some crisis numbers, and that was really impressive. I thought Google's Gemini, so I think they're definitely getting better at that. But I don't think we want to be relying on chatbots for mental health support, do we?
No, but there are some really good things. I did find, I can't remember what it's called now, but there is a website created by a young man that experienced the loss of a sibling via suicide, and he's created a website where when you enter the website, you get a letter written by
the guy that did the marathon recently. Yeah.
Oh, it was beautiful. Like I was really moved, and I thought that was a lovely idea as well, just because all they've got to do is go on the website, and that's it. They'll get a letter from a stranger with words of support, and I think that could mean everything when you're on the edge, when you're feeling at your lowest. And I thought that was really lovely.
Yeah, we'll put it on screen, actually, the actual website of the charity. I think it's something. Why you should stay, or something like that. Maybe it was something like that. Why you should stay.
Yeah, maybe something like that.
Yeah, and
yes,
I'll put it.
Reasons to stay, or
I think
something
it's
like
reasons
that.
to stay. That's right. Yeah, I'll put it on. Put it on the website as well, so people, because I think it's a great venture, and apparently it's helped millions already. So that's really good. And yeah, I think things like that are massive for when it comes to technology. I mean, a part of this study as well, a lot of the people surveyed do think that chatbots are bad for mental health. I think it was 36% of people said it, but they did say physical, in regards to physical health, that they did rate it quite high. So,
okay.
I mean, for me, I'd be happy with that. I'd be happy with that, mostly keeping it for physical health compared to mental health for now. But I mean, maybe I'm biased on that, because I mean, as a therapist, we want to stay in a job as well, don't we? Because ultimately it's going to take a lot of jobs.
We do.
Yeah.
But I think it can't replace that warmth, that regard, that of sitting with someone, of sitting with another person through a difficult time. I think it's going to struggle to emulate that.
Yeah, and the only thing I am concerned with AI is that it's need to impress you or to keep you on side, and I'm just worried about if some people think, oh, I've got a rash on my leg, I'm thinking about amputating it or something, it will probably come back to, oh, that's a great idea. You can go as a flamingo to fancy dress in the future. Like it will find some bloody reason to say that it's a good idea, won't it? Always. So I am concerned a bit about that, because when I first started using it, I did love it blowing smoke, as to say, but I've found it a bit sickly and a bit cheesy ever since then. And yeah, I think that's why things like Claude maybe are a bit more sterile and don't blow smoke so much. But that's what's good. There is lots of choice these days, so I suppose find one that's right for you.
And I think, and they just need to be careful in regards to safety as to the limits there. And should they have things in place that say, oh, I think you should see your GP? Should they be reminding, whilst talking about health problems, this is great, but make sure you take this to your GP?
Definitely. Yeah, I think that's always got to be like a caveat on every chat, hasn't it? And I think always crisis numbers as well. I think like that, as we did the previous video, NHS 111 option 2. I think that's always got to be the heart of the chats as well, especially when there's a shred or a scintilla of mental health mention, especially when people are hinting that they're in a difficult place. I think that's a must. But yeah, I mean, curious to what everyone else thinks as well. What do you think of chatbots? Do you use it for your healthcare? Is it something that you rely on? Something you think is a bad thing for society, or a bit neutral? As we kind of, I suppose we've sat on the fence a bit today, you and I, haven't we? I mean, are you in the same part of the fence as Shelley and I? What do you think? Drop me comments below, and really appreciate your contribution to our conversations. And as always, please like and subscribe, and we'll see you next time. Thanks.
Take care.